Hey there, Karen here. I've been getting a lot of questions recently about what the heck is RRT or rapid resolution therapy. And I wanted to give you my take on it and what I've experienced personally and what some of my clients have experienced. So, the premise behind rapid resolution therapy is you should not have to relive anything difficult or traumatic in order to heal it. That there's nothing wrong with you or your mind. There's just some data that's stuck in there. And through rapid resolution therapy, we actually get that data moved into long term storage where you're not tripping over it anymore. So imagine if your mind were a house and every event that hasn't been fully processed. And the way you can check to see if it's been processed is if you think about anything that was difficult or traumatic for you in the past, and you feel any type of disturbing emotion or any kind of physiology in your body, like tightness or rapid heartbeat, palpitations, sweaty palms, irritated, angry, sad, depressed, hopeless, any of those things, that means they haven't been fully processed. Now, back to the house analogy. So, the things that haven't been processed start building up. They stack up in the hallway. So, anytime you go from the kitchen to the bedroom or the living room, you're tripping over this stuff. So, you might be reactive in your real life instead of being calm and having a regulated nervous system. You might be irritated a lot. You might get angry with people or afraid of speaking your truth or using your voice or of disappointing people. So those are like the common ways it shows up. In rapid resolution therapy, we can take large chunks of data. So the mind will classify and put a lot of events together in one single file folder, so to speak. And by working with one or two of those, we're able to get the good news to the subconscious mind that these events are no longer happening. And what's been happening is when you feel any type of disturbing emotion, your mind is trying to get you to take an action. And because the subconscious mind only thinks in the present tense, it wants you to take an action to prevent getting hurt. It thinks it's happening now, but it might have happened 20 years ago, 30 years ago, 40 years ago. It could have been, when you were 2 years old. It wants you to fix something that cannot possibly be fixed, because how can you prevent anything from happening in the past? You can't really go back. So that's how we get stuck in these loops and blah. And one way to get that message is we call it multi-level communication. And so I'm speaking to the conscious mind and the subconscious mind at the same time. So once the subconscious mind really gets it, that there's nothing for it to do, it calms down. It's like, oh, there's nothing for me to do here. And then your body can go into maintenance and repair, can go into rest and relaxation. You can access those higher states of consciousness like logic, playfulness, curiosity, passion, compassion, all the things that make us human, really, the ability to think at a higher level. But if you have a triggered nervous system, all of that shuts off. Your prime directive is survival. That's it. Subconscious mind only wants you to survive. And if it thinks you're about to be attacked by a predator, you are being attacked by a predator, or you just got attacked by a predator, it's going to produce this chemistry in your body, which is also known as emotions, to try to get you to take an action. So the RRT process starts with developing a deep connection between the facilitator, me, and the participant or client, you. And once we establish that connection, it is kind of the thing that keeps you anchored in this present moment. So you're not going back and like getting in the fetal position, reliving something. I keep bringing you back to me. Come back to me, come back to me if you start to go there. Now, generally, that doesn't happen the way that I do things. That hasn't happened yet. I'll say, open your eyes, come back to me, come to, identify something in the room. In this moment, you are safe. You're in your chair. You're talking to me over Zoom, like nothing's happening, right? So then the next part is for me as the facilitator to have a clear intention. So I have a generalized intention before I start a session, and that is for your mind as my client to entertain only thoughts that have value about things that are possible to do and good to have done. which means possible to do. Is there anything you could possibly do about anything that's happened in the past? No. So your mind doesn't even go there anymore. And then good to have done. There are a lot of things that you want to do. You may use the word I should do, things that will lead you toward where you're going, toward your goals, your dreams, your desires. But they're scary as hell if you've never done them. So your mind starts to attach value to doing these things that might be difficult to do in the moment, but you're going to feel really good about yourself afterward. Then it also attaches interest, appeal, and pleasure to doing them along the way. So let's say your goal is to release 20 pounds. Your mind will start attaching pleasure to making healthy choices that are leading you to thinner and thinner and thinner. So hopefully that makes sense. And then the other thing is for you to feel satisfied in having done those things that were good to have done. The other part is, as you're telling me where you've been experiencing any stuckness or turmoil recently, I start to see you a certain way, like free of those behaviors or stucknesses. And I develop a very specific intention, and then I share it with you. I'm like, okay. And along the way, of course, I'm checking like to make sure I'm really, really understanding you and understanding what you mean, not necessarily what you're saying, but what you really mean and what's underneath it all. Then I share that intention with you and I check, did I get it? Would you like to add anything? And sometimes people say, yeah, I really want to add this thing, like consistency piece or something. Then every single thing I do is aimed at causing that intention to take place. The third part, which is the most crucial and really, really different about rapid resolution therapy, is that I take 100% responsibility for causing that shift, for causing that intention to happen for you. Now, what does that do? For me, it gives me power to cause it. And it's like trusting my mind to come up with solutions. Trusting, for me, it's connection to source or God. But also for you, you get to relax. I don't know what therapist has ever said to you, I am responsible for your results. For me, it's been the opposite. Like you didn't do the work. That's why your life is still this way. Right. And most people are quick to move responsibility onto somebody else because they don't want to be responsible for someone else's failures. Well, I want to be responsible for all of it so that I can cause something great to happen for you, a shift. And that gives me power to do it. So there are lots of different perspectives we ask you to try on, not to accept as perfect truth. What do we treat? Obviously, trauma, any type of difficult or traumatic event you've ever gone through. Like I said in the beginning, like you ever feel any type of like uncomfortable feelings or unpleasant feelings that hasn't been processed. Anger, really, really simple, believe it or not, to treat. We don't manage it. We dissolve the root cause, that stuck data in the mind. We dissolve it. Sadness, depression. After I did rapid resolution therapy, I was able to get off of 2 antidepressants with the help of my psychiatrist, of course. I also got off of Adderall, and I also stopped identifying as an addict. Now, I had been sober for 3 years before I did this. So I do not treat active addiction. What I do treat is cravings. Like if you've been sober for a period of time, you've already detoxed and you start to feel cravings. Also, I believe like if you've gone through traditional 12-step, for me, I was only one trigger away from the addictive behavior again. So this resolves the root cause, and we can also treat cravings as well. Physical pain, if your body isn't healing, and pain is a signal to the mind, it wants you to not die whenever something traumatic happened, whenever you almost died. So that one, believe it or not, sometimes goes away really quickly, because when the mind gets that the pain isn't necessary to get you to make a different choice, it stops sending that signal. So any type of healing that you need going on, it treats that. Heartache, I mean, whatever, guilt, shame, low self-esteem, depression, a lot of different things. So the other thing is, if you are self-sabotaging or you have behaviors that you're like, why did I do that again? any type of belief that's in there. That's all unconscious and that can all be treated. Generally, most people that I see get results like the results they want in 1 to 3 sessions. So depending if you have like something complex that happened over a long period of time, you may benefit from 3 sessions. Otherwise, do a session and see what happens, because it is, like I said, my responsibility to cause a shift in every single session. And I am so confident in doing that that I still haven't had anybody not clear stuff. It's just not, it doesn't happen. And the way it's done is so lovely and almost painless. Sometimes people will cry, but then when they talk about it afterward, they're like, it wasn't painful crying. It was more like a release. So like letting go of the old or of the pain. So if you are intrigued, you can book a call. We can talk about your specific situation, or you can just book a session. I mean, let's go. All right. We'll see you on the other side.